Hi there. Here is a case study for you all where a patient is unable to abduct her left arm after an accident. So this indicates the damage of which of the following parts of brachial plexus. So one thing you have to know, abduction. So medial trunk and the lateral cord options are, second option is the upper trunk and the posterior cord, third option lower trunk and the posterior cord, fourth option is the middle trunk and the anterior cord of brachial plexus. One thing you have to know, in brachial plexus there is no anterior cord, so this won't be there as the answer. So what about other options? So here the key word which you have to know is abduct. So what muscle helps in abduction at shoulder joint? So one is deltoid, which is a primary abductor, but initiation of abduction is done by supraspinatus muscle. So initial 15 degrees of abduction is done by supraspinatus, and beyond 15 degrees to 90 degrees it is purely by deltoid muscle, that is the middle fibers of deltoid, and above 90 degrees along with the deltoid there are other muscles like serratus anterior and all. So here the patient is not able to abduct, means mainly supraspinatus and deltoid are affected. So what is the nerve supply for these two muscles? So the nerve supply is the axillary nerve, and supraspinatus is by suprascapular nerve. So the answer is upper trunk and the posterior cord. So let's discuss more about this. So here is the brachial plexus, the axillary nerve. It is arises from the posterior cord of brachial plexus. This thing you have to note down. Next, about our suprascapular nerve, you can see here suprascapular nerve which supplies supraspinatus and infraspinatus as well, and it is given off at the upper trunk of brachial plexus, which is called as Erb's point. So these two nerves are damaged. So upper trunk of brachial plexus and posterior cord of brachial plexus would be the answer. So the muscles are deltoid and supraspinatus muscles are involved. They are supplied by axillary and suprascapular nerves. The axillary nerve is the terminal continuation of posterior cord of brachial plexus. So the answer is the posterior cord, and suprascapular branches off from the upper trunk of brachial plexus. So the answer is upper trunk and the posterior cord of brachial plexus. Thank you.